Sorry about that. Good morning. My name is Erica Jimison. I'm here from Easterseals, Colorado, and the Colorado Respite Coalition. On behalf of the Colorado Respite Coalition and JFK Partners, I'd like to welcome you to the first of 4 webinars in the Challenging Behaviors in Respite Care webinar series. Today's topic is Understanding Challenging Behaviors in Children. We have about 146 registered, with the majority joining by live webinar. We are recording today's event and will archive it on the JFK Partners and the Colorado Respite Coalition website, along with the other webinars in this series. There will also be an educational handout with all of the content and a discussion guide to accompany the recording. Following the webinar, you will receive a link requesting an evaluation. You may request a contact hour in the evaluation, and it will be emailed to you in the next week or so. Web participants can ask questions via the chat box. Please select everyone from the message options, and please be sure to mute your video and microphone. For those of you here in the room, please use the microphone we bring you to ask questions so that everybody online can listen also. And thank you to everybody who submitted questions ahead of time. We will endeavor to answer all of them throughout the presentation. So now on to our speakers. Thank you so much for joining us. We have Kate Loving, BA and Educational Director of the Joshua School. Kate Loving recently took a new position as the Educational Director for the Joshua School, which is a school that serves children with autism spectrum disorder and developmental disabilities. For the previous 7 years, Kate worked for the Colorado Department of Education as an ASD specialist, where she provided coaching and consultation to districts around the state. Over the past 4 years, Kate has worked with districts around the state of Wyoming in implementing evidence-based practices for students with ASD and ID. Kate is a BCBA, and in her private practice, she specializes in working with young adults with ASD and significant behavioral and communication needs. We also have with us today Kristen Kaiser, MA from JFK Partners and the Joshua School. Kristen Kaiser joined the Joshua School in 2015 as the Director of Strategy and Development. She is responsible for assisting the Executive Director in operations in the 3 campuses and in operational and regulatory compliance. She works with the development team on grants and overseeing development activities. She also provides staff and parent training on effective team communication. Prior to joining the Joshua School, Kristen has and continues to serve as Lend Family Discipline Director at JFK Partners, UC Denver School of Medicine. There, she spent 9 years in training in multidisciplinary professionals and in the Lend program on disability and the family experience. She also has developed and implemented family support programming for families newly diagnosed with autism spectrum disorder at JFK and with the University of Wyoming WIND program. Kristen has served on a number of interagency committees, including CAN DO and the Colorado Department of Education Autism Task Force. Last but not least, we have Brian Talon, LPC and Program Director at the Intercept Center from Aurora Mental Health Center. Brian Talon is the Program Director and Licensed Professional Counselor at the Aurora Mental Health Center in Aurora, Colorado. Brian manages the Intercept Center, which is a collaborative program between the Aurora Public School District and Aurora Mental Health Center. Intercepts provides a day treatment and mental health outpatient services to children who have a dual diagnosis and their families. Brian has been a clinician for over 25 years, working with adults and children who have developmental disabilities. Brian served on the National Association for the Dually Diagnosed Board of Directors for 8 years and is a contributing participant in the National Child Traumatic Stress Network's IDDN expert panel. Brian provides training nationally and internationally on the topic of dual diagnosis. And please, a reminder, if you're joining by webinar, just to mute your microphones. Thanks very much. You have to share the screen.
All right. Thank you guys for coming today. It's nice to be here talking about this subject that is near and dear to all of our hearts. So we're going to talk about a lot of things today, but just some things that you can expect. We're going to talk about how we think about behavior. Um, there's some things that you can do kind of in the moment that are strategies that might work, but really what's most powerful is really learning about what is challenging behavior, why it's happening, what part the environment plays on it. So really, how do you analyze behavior? And that's really the power of what we'll talk about today, at least for the first part, is really kind of giving you guys some tools to really be able to figure out, this is what's going on and here's what I can do about it. We're going to talk about what we can do to change behavior. We'll talk about maybe some of the things that are a little bit quicker fixes or things you can do in the moment. But again, some of the things that have taken a lot of years to form. A lot of our guys have been engaging in some challenging behaviors for a long time. And so sometimes behavior change is a little bit slower than we'd like, or just takes, more repetition and predictability and things like that. And then Kristen is really going to talk about how we talk about behavior with families. I know some of you are family members, some of you are respite providers, and maybe a variety of other positions, but what does it look like and what are kind of best practices in working with families? And then Brian's going to talk a lot about how do we cultivate resilience. And so this is a really hard job, whether you're a parent or a respite provider or a staff at school or wherever you are. It's a really hard job. We think it's the best job in the world, but it's also, we acknowledge it's really challenging. So we're going to talk about some of the resilience factors. Is that weird? Okay, perfect. Okay, so some of this stuff in the beginning may be things that you guys have heard before, but again, we're really trying to focus on how you guys think about behavior and some of those cognitive processes that go into addressing challenging behavior. And so you guys probably know all of this, but we know that behavior has meaning. So behavior doesn't just happen for no reason. There are always reasons. And this is not just kids with autism or developmental disabilities. This is all people. So we do something because there's a payoff for it. And that's when we'll talk about kind of the function of a behavior. Even though sometimes it's hard to tell, like, what is going on? Why are you acting this way? There's always kind of a way to figure out what's going on, and so we'll talk about that. And what we know is that behavior is really influenced by the environment. And I come from a background of applied behavior analysis, which is kind of the foundation of everything we do a lot of the things that we do at the Joshua School. But what we're really interested in is looking at how does the behavior affect the environment? How does the environment affect behavior? Because we have a lot of control over the environment. We may have less control over the actual behavior, but it's what we can do to manipulate the environment to increase sort of expected behaviors or pro-social behaviors, and then decrease the likelihood of those more challenging behaviors. So a lot of what we'll talk about today is kind of environmental factors. So you guys may have heard of the ABCs of behavior. It's kind of a pretty common piece, and so I don't want to kind of beat you over the head with it. But again, it's just a really important kind of paradigm for understanding why behavior happens. And depending on why behavior happens, our interventions will depend on why behavior happens. So if you have a kid that's running away, you may do different things depending on why they're running away. Are they really escaping the environment? Is it overstimulating? Are they looking for that attention? And so really we're looking at how we figure that out is to look at what's happening before the behaviors, which we call the antecedent. The behavior is just any kind of movement or action of behavior. And then we'll also look at the consequence. So what are some things that we can do after the behavior that will have an impact on the future frequency of the behavior? So these are all things that we have control over, and just understanding what we can do in the environment will have an impact on the behavior. Again, there are some things we can do kind of in the moment, or supports that we can put into place that have more immediate effect. But a lot of this has been shaped over time and reinforced over time, not because anyone is purposefully reinforcing challenging behaviors, but just because we may not really understand what's happening. We may have different people that are trying different things, and we're kind of inadvertently reinforcing challenging behavior. So I think an important piece is really making sure everyone's on the same team. At the Joshua School, we have lots of kind of behavior plans that everyone follows. I know it's a little bit more fluid in your environment. Home is a little bit less of a, it just has less structure. I relax on the couch at home, and if I feel like cleaning, I clean, but I may not have necessarily routine. It's just kind of a different environment, and so we're going to talk about how we can kind of control things in a less restrictive or less structured environment. So everything we talk about today, we're going to be talking about the ABCs, the antecedents, so just what comes before the behavior, so what the actual behavior is, and then the consequence. So really that's having to do with how we respond to the behavior. And you may see behavior change right in the moment, like, oh, I just gave a visual support and that really worked. Or it may be over time that we're going to put this intervention into place, we're going to use this regular visual schedule, and over time we're going to see decreases in challenging behavior and also the increases in the kind of behavior that we want to see. So we're going to talk about why behaviors happen again, and you guys may have heard some of this before, but behaviors happen for a reason, and there's really primarily kind of, Brian will talk about some other kind of mental health and sensory things, but when we're really looking at why behavior happens, again, for all people, not just people with autism or developmental disabilities, but we're looking at people do things because they want access to tangibles. So I go to work because I get a paycheck. I also love it. There's some social pieces for me, but I get something at the end of the day. We have lots of our kids that really love iPads, so we may have some challenging behavior around, I want that thing, but I don't have the communication to tell you I want that thing, so what I know how to do is use my behavior. Also, gaining access to attention or trying to avoid attention we talk about. Again, this underlying deficit in communication, I imagine you guys all work with students or individuals that have communication challenges, and so we may not know the right way to get attention. And in the past, when I hit, someone says, hey, don't hit, I got attention. And so what I know is that the way I get attention, even if it's what we perceive as negative attention, it works for me. That's the way to get attention. So we'll talk about some interventions to kind of address that. Yeah, and Kristen has something to add.
Yeah, I was just going to say that I also think that sometimes that attention piece can be really difficult to figure out, right?
For sure.
So can you talk a little bit more about the difference between kind of gaining attention and avoidance, that negative and positive, that there really isn't a difference when you're looking for that attention?
Yeah, so this is a little bit counterintuitive to some people, and a lot of times when I'm working with my teachers, they're like, you expect me to do what when this happens? But for our kids and our adults that we work with and us, attention is attention is attention. So let's say you have a student who is hitting because they may not have a way to say, hey, interact with me, or I want to talk with you, or I want to spend time with you. So even if we give them a verbal reprimand or something like, oh, safe hands or no hitting, that is still attention. And when we're doing things like functional analyses and functional behavior assessments, we actually, and we're trying to figure out the function of the behavior, we actually provide that negative behavior to see if it has an effect on the behavior, and it's pretty powerful. So if kids or your adults or whoever is really seeking that attention, even the correction of, oh, hands down, or safe, or stop, or something like that is still fulfilling that need. Is that what you were talking about?
It is.
Okay.
Yeah, it is.
Yeah.
And I just wanted to add also that anytime that when I hear folks say, well, you know, this child is doing this for attention, I always find it so critical that to ask the very important next question, which is, and why are they seeking attention?
Exactly.
What is that function of seeking attention?
Yeah.
Sometimes it brings adult support. So even if the behavior is maladaptive or perceived to be negative, it brings a lot of adult support and structure to have a more positive experience.
That's exactly right. And for some of our kids, kind of the opposite is that they may not want some of the attention. So it may kind of bleed into that escape, which we'll talk about next. We work really hard, especially with our younger kids, to kind of pair ourselves and to make ourselves really positive so that we have kids or adults that really seek that attention. Sometimes our guys, especially with autism spectrum disorders, may not really know the right way to get attention, or may not see us as kind of inherently really cool people, and so we have to kind of work on that. So it gets a little tricky, and we'll talk about in kind of the strategies. If you have someone that's engaging in challenging behavior for attention, what we can do about it. And sometimes we talk about the attention as like a negative thing, like they're doing it for attention. Well, the function of my behavior of going out and having maybe a drink with my friends is to gain attention. It can be really positive. I think it's kind of what makes the world go round. So really what we think about is, maybe not providing the attention for the challenging behavior, but what is a better way to get your needs met, whether it's tapping you on the shoulder, on your device saying, hey, hang out with me, any sort of appropriate way, because we don't just want to like, let's ignore that, he's just doing it for attention. We always want to teach what's a better way to get our needs met, because we all want attention. We all do lots of things for attention. Again, it's kind of what makes the world a fun place to live in. So the next function that we're talking about is escape and avoidance. And so I imagine you guys see a lot of behaviors that kind of serve this function. And again, this is something we all engage in. When I think about going to the gym at night, around 2 o'clock, I start engaging in escape, maintain behavior like, oh, I gotta finish this report, or oh, I gotta get home because my dogs will miss me, or my husband's gonna be upset if so I start thinking of all the reasons how I can escape exercise. It's just something we all do. I just have a more adaptive way of dealing with it. I don't have to hit or drop to the ground or scream, because I have more kind of adaptive skills. A lot of times we see people escaping kind of demands. So that's a big one at our school. Work has become aversive, or maybe school has become sort of aversive. So our guys get really good at, I see something coming 10 miles away and I'm out of here. Or I know that this person comes in and it means it's desk time. I am out of here. And so we'll talk about some things to do there. We're going to talk a little bit more about like kids that run away or bolt. And so a lot of times we think like they're just running away from something, but there may be some attention stuff in there too. So we'll talk about ways that you can address it. You know, if the function of the behavior is really for escape, then we're going to teach some functional communication around, I don't want to do this, I'm all done, a safer way or a more adaptive way to kind of get out of what you are trying to get out of. And then the last one, and Brian will talk more about this, is really looking at the sensory or automatic function of behavior. And so that is, we do things because it feels good, or we do things to make something that feels bad stop. So you have a mosquito bite, you scratch it, the itching goes away. I'm not doing it because I get attention from people, I'm just doing it because it takes things away, the itch away. We see a lot of this with some of like stereotypical movements from especially our guys with autism. We see if this kind of one of these behaviors is happening where their kids are alone, or they're on the iPad, or they're at work session. If we see this maybe tapping their chest or something like that, if we're seeing that kind of consistently over time, we can really think about, this may serve an automatic function. They're not trying to do it to get out of work, maybe they're not trying to do it for attention, but they're doing it because they're getting some sort of input. And so these are the things where we really kind of control the environment. We work on lots of replacements behavior. So is there something that's more conventional that we can direct our guys to engage in that's still feeding that sensory stimulation need? So we'll talk a little bit more about how to figure out what is the function of the behavior, but these are just kind of the 4 reasons, and we'll talk on some additional terms as well, why people do what they do. And then again, depending on why they do what they do, we'll tailor our intervention to match that. So I wouldn't do the same thing for an attention maintained behavior that I would do for escape. And so it's really important that we're kind of analyzing the environment to kind of determine those functions. So Brian's going to talk a little bit more about some mental health and some sensory pieces as well. And then we'll continue on and just talk about more strategies for what we can do for addressing some of these behaviors.
Thanks. We don't want to spend a whole lot of time on this, but we did really want to mention, as we prepared for this, we thought about how there can be some other mental health conditions and things that could be going on with kids that affect behavior. And we want to talk a little, I just want to speak briefly about some of the major categories and how they may affect people who have neurological and developmental difference. And just because we agree that having a mindset and an understanding about the people that we work with has everything to do with how we react and how we support them. Some of the conditions that can affect people with neurological developmental difference, one of the most significant mental health issues is neglect and trauma. If you take a look at the research that has been done around trauma of people with developmental disabilities, the research says that it's pretty much anywhere between 2.5 and 10-fold what people without disabilities experience. And so this can be all the way from the beginning of in utero to birth trauma to early onset of abuse and neglect. Almost all of the youth that we work with at some point will experience issues like bullying. So trauma is a really significant mental health condition in our population. Many of the symptoms are situational avoidance, night terrors, hypervigilance, being a high state of arousal and anxious, and having startle responses. These are very common symptoms of trauma. And the reason we want to talk about some of these mental health conditions too is because with some additional treatments or specialized treatments, these conditions can be improved or their symptoms lessened. Another thing that I want to talk about is disorganized attachment. If youth experience an early onset of abuse and neglect, especially if there is neglect, what can happen is that a child's ability to attach can be really disorganized and can be difficult in terms of either attaching to people that they don't know very well very quickly, or not being able to attach to caregivers who are loving and supportive. And actually, in some ways, if kids have gone through situations of early onset of abuse and neglect, the way that I conceptualize this, which is hard for those of us who have had normal attachment to understand, is that if a caregiver who is your lifeline as an infant intermittently becomes a threat to your life, you can start to equate love and attachment with fear, which is a very unusual and difficult condition to understand, and it's very debilitating. Another area that I want to talk about also are mood problems and mood disorders, and talking about anxiety, talking about depression. And the things about anxiety and depression is that these are, they can be symptoms, they can also constitute conditions and diagnoses. If you have a neurological difference such as autism, when you struggle to interface with the world around you, that can make the world kind of a scary and unpredictable place, which creates a lot of anxiety, which is a symptom. If you experience a lot of trauma, there's a lot of sadness and other kinds of depressive symptoms that are affiliated with that. However, I guess, and this is a gross oversimplification, however, but we do take a look to see if those symptoms, such as anxiety and depressive symptoms, if they seem to be disproportionate to a child's disability, then it may constitute some sort of biochemical difference that they may have that can be improved with or can be lessened through other treatments, such as learning to manage those symptoms or medication management. I also want to talk real quick about attention deficit hyperactivity disorder, probably the most overdiagnosed condition in our population. The reason I think that happens is that a lot of medical professionals in all of their best efforts will often not see or specialize in kids who have neurological difference or developmental difference. And so they will take a look at maybe a 7 or 8 year old in their office, and they'll see a child with the normal developmental attention span of a 3 or 4 year old. And we'll say this is abnormal and therefore it's an attention deficit and want to treat it with medication. So we have to be really cognizant of what is the appropriate developmental level that we expect from this child in terms of their attention span or their activity level. One of the things that often happens is that pediatricians or a physician will prescribe an ADHD medication, and it'll exacerbate the symptoms. It'll make it much worse. That's an indication that it's not attention deficit hyperactivity disorder. One last area I want to talk about is also psychosis or thought disorders, which are usually characterized by auditory, visual hallucinations, tactile hallucinations, very delusional thinking, and lots. What I want to say about this is also an overdiagnosed condition in our population. Mental status exams are used to assess these kinds of conditions, where we ask questions like, do you hear voices? Well, guess what? Our concrete thinkers often answer to a question like that. Of course they hear voices. What I want to say about that is that there's many other negative symptoms that come with auditory hallucinations and delusional thinking, significant disorganization and confusion, lack of hygiene and ability to track. I mean, there's lots of negative symptoms that come along with psychosis that you would see that would constitute a diagnosis of a mental health condition that's significant. I want to move on though to the area that I think that is very significant for our population, that significantly impacts behavior, that has to do with sensory integration dysfunction. In our brains, we have a little regulatory area that helps us focus attention. It also regulates, like wherever you are and listening to this webinar, your brain right now is screening out all kinds of noises and things. It's screening out your attention to the lights or maybe the sound of your heating system. And in some of the youth that we work with, that regulatory agent doesn't work very well. And so often kids become hypersensitive, which I think is more sort of the classic that we associate with autism, where the kids get overstimulated and they cover their ears and they cover their eyes and it's overstimulating, and so they do things in order to focus their attention on something that they can control. That's hypersensitivity. Loud noises, fluorescent lights, certain tactile clothing, certain food textures, all of these things can be aversive to kids with hypersensitivity. And then we have youth who have, and by the way, we're all on the spectrum. we all have hypersensitivities or hyposensitivities to stimulus. I'm a hyposensitive person, which means that I really like sensory stimulation. I like my food spicy, my music loud, my motorcycles fast, right? And we're all on that spectrum. So are the youth that we work with. Hyposensitive kids are the ones they'll be chewing on their sleeve, they'll be rocking, they tend to grapple their peers when they play, they're really rough and tumble. They need lots of sensory and stimulation, lots of input, and tend to really, it drives their behavior. And then we often see youth who have, because that regulatory part of the brain does not seem to work well, they can flip from one to the other and can do it quite frequently. So at one moment they're seeking a lot of sensory input, and then other times they're overwhelmed by it. So what I want to say is that, these youth really need a good evaluation of an occupational therapist who understands, who's been trained in sensory integration dysfunction. Because one of the things that can really help children is that they get a sensory diet. And what I mean by that is that there's certain interventions that can be used, like joint compression and brushing, and vestibular stimulation, such as swinging or rocking, spinning, that activates the vestibular system, weighted vests. I mean, these are all just examples of interventions that can be built into a diet that children have, and also learning ways to escape. We're going to talk about escape behaviors more. When they get overstimulated, learning how to escape situations, and kids can learn how to regulate their neurological system themselves.
Brian, I was going to say an interesting thing about that mix of hypo and hyper is that it can be very confusing for providers and for family members who are looking at a child or a student who is very much a sensory seeker, but tactily defensive. Mm-hmm. So a lot of that sensory input that they're looking for needs to be on their terms. So they might be incredibly huggy, mm-hmm. but only when they're initiating the hug, right? But then another student might go to touch them and they scratch or they bite or push, because it's that tactile defensiveness. So I think that can be really difficult to parse out when you're working with children.
Absolutely. It's a really important point, because you really have to meet the child where they are in that moment and what their neurology is calling for at that moment. And yeah, thanks for adding that. Just a couple of things that I want to mention real quick too before we move on is, one thing that can exacerbate behavioral problems also is caregiver inconsistencies in terms of the way that they respond, and that can be due to all kinds of reasons. I work with a team of professionals who are absolutely fantastic at what they do. We still have inconsistencies in the way that we interact with the kids because we have different personalities. We were raised different ways. We were brought up differently. We have different thresholds for as I'm going to talk about later too, in terms of our resiliency as caregivers. But really significant things can happen too, where if caregivers have significant mental health issues. Also, one of the things that's very normal is that parents and caregivers, guardians of children with disabilities, we carry a lot of fear about what kind of experiences they're going to encounter. We know that trauma is a significant issue. We have fear about that for the children that we work with and the children that we parent. There can be guilt about their disability and what did I do in order to contribute to this struggle that my child may encounter in life. And those things can interfere with a caregiver's having appropriate limit setting. So we'll talk about how to address that coming out and hopefully be the meat of today's presentation. And I just want to say real quickly, before turning it over, is that, when a child physically acts out, there's some really important things that this is a really fantastic last resort for them. It serves an important function. Number one is that when you physically act out, you release endorphins. I mean, we all do. And these are really powerful chemicals that mask pain. And a child having a significant physically acting out event doesn't look like they're having a good time, that it feels good. But I have seen youth injure themselves and not even realize it because those chemicals are so powerful that maybe they don't realize they suffered an injury until 10 or 15 minutes later, and those endorphins have left their bloodstream. So it does mask pain when you physically act out. It does release those endorphins. And the other thing is that it also, regardless of their inability to see the long-term consequences, physically acting out will take control of the immediate environment. If you've ever worked with a child who has significant sensory problems, toothbrushing is one of those. It's just invasive, it's aversive. You have to brush their teeth, otherwise they'll have health problems. So you set up, if you bring a child into the bathroom to brush their teeth and they break the mirror, the shattered glass, the screaming, all of the chaos is not the outcome that they were looking for, but the toothbrushing stops. And so it serves a function. And we have to, my colleagues here help me reword my slide here from talking about aggressive behavior to talking about physically acting out, because of the value judgments that are laid on terms such as physical aggression. When you think of physical aggression and you lay those value judgments on a term like that, it really changes our mindset and our interpretation of the function of that physically acting out and what purpose it serves for youth. So now I want to turn it over to, we're going back to.
Okay, so now we're just going to talk about some strategies that may be effective, and we're starting with some things that you may have heard of before, but visual supports is like one of the #1 evidence-based practices for individuals with autism, not just for people with autism. We all kind of rely on visual supports, but we have proven over and over in lots of research that visual supports are really fundamental in terms of teaching new skills, managing challenging behavior, decreasing anxiety, lots of things. And so when we're looking at using visual supports, we're talking about things like visual schedules. So if you have 2 hours with a student, figuring out a way, how can I visually indicate what's going to happen? You can have the things that you have to do in there, like brushing your teeth or taking a shower. That can be followed by iPad or something really fun, so your guys can see, well, I have to do this stuff that's not that great, but then I can get something that's a little bit more reinforcing for me. We use lots of things like, the whiteboard is like my favorite favorite teaching tool of all time when I was a teacher, and when I'm doing lots of consulting in schools. If I could choose one thing, it would be a whiteboard. I never want to be in a place with a student where I have to rely on my verbals. It's just not a great place to be. I'll also I do lots of diagramming or cartooning out, and even if you feel like, oh, my guy doesn't understand that, our guys really respond well to it. It's a visual input is much easier to understand for a lot of our guys with autism and other disabilities. So if I don't have all these pretty pictures or an iPad for my schedules, I can just kind of cartoon out. First, we're going to go to the park, then we're going to take a shower, and then we get iPad and dinner, but just kind of drawing some things out. We also use lots of like mini schedules for routines in the bathroom so that our guys can see kind of step by step what's going to be happening. Because of sort of deficits in communication, our guys may not be able to see like what's coming next, or what do I get to do, or when is this thing happening, but likely they're feeling a lot of anxiety about it. So I'm just going to give you lots of information about what's coming next. I'm going to give you a little control. For a lot of our guys, we have kind of, here are the schedule things that need to happen. Why don't you fill in the rest of the things that you want to happen, or when do you want to eat lunch, or whatever those may be. And if you Google visual supports for students with autism, there's like a zillion different like Pinterest pages and lots of different things that you can kind of get ideas for. But any information that you think is really important for someone to have, instead of just saying it, putting it in visual support, so that's pictures or writing or drawings, is oftentimes much more effective.
Kate, I was just going to add that I think it's really effective even for our kids who are high functioning,
For sure.
quote unquote,
Yeah.
or highly verbal,
Yeah.
where a lot of people in their life would assume that they don't need that level of
Yes.
support, but really breaking down social situations by drawing with cartoon or
Yep.
breaking down their schedules is incredibly helpful.
100%. Thank you for adding that. I think we do presume that, well, our guys can talk, and so I can just talk to them and tell them what's going on.
So there's a question from the webinar folks about whether or not there's an app like Boardmaker or something else that's available on phones or things like that.
Yeah, so this one on the right, that's the Gracie's Good Morning, it's called First Then Visual Support, First Then Visual Schedule, I think, and it's a really cheap app that I use with some of my adult clients. And so it's cool because you can import pictures in there. They have a bank of pictures. You can import video models. So let's say putting on lotion, you can take a video of someone putting on lotion or the steps of putting on lotion. So when they push it on their schedule, a video will show up, and that can be a really nice model for them that this is what it looks like. You can embed communication in there. So there's a zillion different apps out there, but I really like this First Then. It's pretty inexpensive. You can use it for Apple and Android. Is that a thing? And then again, you know, some of the stuff that we use in different schools are Boardmaker, which a lot of people use, or symbol sticks or symbol systems. But I like the First Then visual piece for students that need more picture-based support. Good question. Some other types of visuals are timers. Timers are another, like, one of the things that I can't live without. So you can use it for countdown to things that are going to happen that may be more challenging. So let's say your guy or girl or whoever you're working with, your individual, is on the iPad, but it's soon you have to be transitioning to take a bath, which might be a real hard sell for some of our friends. So you can set the timer for when the timer goes off. This is what's going to happen, and we're going to show you on your visual schedule. We have 10 minutes of iPad, then we're going to do showering for 10 minutes, and then maybe you get your iPad back, or what are we going to go on to? So sometimes processing time is really hard for a lot of the people that we work with. Understanding kind of the conventional process of time passing, and so making it really visual is really important. I like to use this weight box for giving up items. So I have a ton of people I work with who, and it's true for me too, don't want to give up. And I keep saying iPad just because that seems like a real popular thing these days. But again, it's a hard sell to say, put down your iPad and come take a shower. So that's not going to go real well most of the time. We have a lot of our guys that will hold on to it or engage in challenging behavior because they don't want to give up their preferred items. A lot of that has to do with, I don't know when I'm going to get this thing back. And I don't have the communication skills to say, hey, I want that. When can I have it again? So again, going back to your schedule and showing, well, we're going to do iPad and then shower and then you get it back. But instead of taking things from people, we kind of teach a wait box. So we're going to first practice, we're going to put this iPad in there for 1 second. We're going to count and then you get it back. And then we're going to put it in for 5 seconds and then you get it back. And then we can like lengthen that over time and teach, this is a place where it waits. And then when we say you're getting it back, you get it back every time, but not kind of sometimes jumping into that, hey, give up your favorite thing for 2 hours while we go out in the community and go shopping and take a shower is a real hard sell. So we kind of shape it up that way. And then I'm sure a lot of you guys have used this before, but just a simple first then. And the power really is, I think we use a lot of first then language, but just putting it into a visual support. And again, this is something, if you don't have Boardmaker or, it takes forever to use Google Images, you can just kind of diagram out and write things out about first we're going to do this and then we're going to do this. So just some quick ideas for visual supports. The next one we're going to talk about is a behavior map. And so you could do a million things with the behavior map. I think it's kind of one of our ultimate behavior supports, visual supports. So what you would do is put kind of the issue in the box that's on the left. So it may be, let's say, when it's time to take a shower. So you're going to give kind of the contingency plan, and green is kind of the expected, the red is kind of the unexpected. So you may write in here, you may draw it, when it's time to take a shower, if you turn your iPad off or ask for more time, then you get more iPad eventually. If it's time to take a shower and you scream or you hit, then iPad is finished for the next hour or something like that. You can do this kind of proactively or on the fly. Last time I was in one of my schools in Wyoming, there was a little guy who likes to, or maybe not likes, but he drops. He engages in dropping behavior, which is real effective, especially as you get older. Like, I don't want to do that thing. I can plop myself on the ground, and what are you going to do about it? So we can do something like, when it's time to go back to class, if you walk, and use safe hands, then you get to have, 10 minutes with your friend. If it's time to go back to class and you drop and you kick, oh, no time with your friend. So it's not punitive, it's just kind of diagramming sort of the consequences of our actions. It sounds like, oh, that, maybe that might not work with my student, but it's worked with a lot of the people that I have worked with. Again, you can do this for, Chris was talking about the social experiences. If you have, let's say you go to the park and something happened, you can go later, like, let's talk about what happened, and not just talk about it, but you wanted the slide. Oh, if you would have asked, used your communication, you would have gotten the slide. Oh, but let's look at, you wanted the slide, you pushed, and you were unable to go to the slide. So let's really look at the kind of the alternative. We always want to be looking at what is the expected or the alternative behaviors. And again, I just kind of draw this out on a whiteboard. You can do it beforehand to prep someone. We're going to go to the park. Remember, when you want the slide, you can ask for it, and then you get the slide. And then here's kind of the unexpected too.
I think too, Kate, that what's such a beautiful thing about this is that a lot of our kids really struggle with that executive functioning piece. So understanding the consequences of their behavior, they can't think far enough ahead to know what that, and so mapping it out for them really does provide them a concrete way to think about getting what they want.
Yep, absolutely. And I didn't include it in here, but there's a more advanced version called social behavior mapping, if you Google that. And that really looks at a person's behavior. And again, you write it out or you draw pictures, how it made them feel, what the effect was on the environment, and how that made other people feel. So again, supporting some of those executive functions in terms of, when I do this, this is what happens, and this is the effect. You can draw lots of the social stuff. When you do this, people feel really good, and then they want to play with you. Oh, when you do this, people feel kind of bad about it, and they don't want to play with you. And so looking at all the positives and also kind of those more unexpected behaviors. So just a couple of the visuals. The key to this is that always, not always, I'm going to say most of the time, visual is better than verbal. It's just easier for our guys to access, especially in times of crisis. The last thing we want to do is to just be talking with our guys, because they're not really processing it. For a lot of people, it just is escalating. And so writing things down, giving some cues, even if you want them to sit down, writing it out instead of talking to them about it, is just a nice strategy to use. So now we'll talk quickly about some proactive strategies, and then some things that can happen, or that you can do once the behavior has happened. So a lot of our a lot of what we're going to do is these antecedents or proactive strategies. I get a lot of calls, or when I was working in the Department of Ed, for what do we do if this happens? And a lot of times we go back to, okay, here's what we can do in the moment, but next time here's what we're going to do differently, because it is so powerful what we do before the behavior happens. That's when we have most control over things. So things like arranging the environment, and an example of this may be, we got a couple questions about driving and challenging behaviors in cars. And so for one of my young adults that I work with, driving is really hard. Staying safe in the car is really hard. So we kind of isolate some of his favorite things. He has all these items that he loves. And so he doesn't really get access to those just throughout his day. We kind of use those in the car. So as soon as he gets in the car, he has this box of stuff that can kind of occupy his time, and we change it up really quickly, because he kind of, once he's played with it for a little bit, he's kind of over it. And so we have a ton of things that he can pick from. So just trying to kind of arrange that environment or enrich the environment so that there's more things for him to do, instead of kind of focus on the fact that he's in the car and he's transitioning somewhere, and transitions are really hard for him. We talked about schedules and routines, and I think this is one of the most powerful sort of interventions that we can put into place. So, and this goes along with structuring time, but really breaking down simple tasks into steps, breaking down your time. I think if you kind of do nothing else, for me, I would have you implement visual schedules. And again, it doesn't have to be fancy. It can be on a whiteboard. You can do it with Google Images, but really letting our guys know what's coming next. We talked about structuring time. So we may want to go to the park and have a lot of fun, but that is like a whole lot of environmental variables that we may not be able to control. So I may start with a quick, simple visual. We're going to go to the park, we're going to slide once, and then all done, back to the car, and then we can come home and have a snack or something like that. But really starting small and moving slowly, but structuring that time. Again, coming back to communication challenges, our guys may not be able to say, like, how long do I have to do this for? Or when do I get to go home? Or what am I supposed to do? So visually indicating all of those things is really helpful. And then we'll talk a little bit more about reinforcement, but just providing high interest items to increase interest and motivation. So a lot of times in schools, if students have special interests around a certain topic, we'll incorporate that into their learning. And so it makes the learning a little bit more non-aversive and a little bit more attractive to our students. I know this is a lot super quickly, but we're just trying to hit on a few things. We talked about enriching the environment, especially if you have guys that engage in challenging behavior for escape purposes. So you may enrich the environment so all of their favorite things are kind of around, so that they're less likely to bolt out the door to go find something because they know it's around in the environment. Always look at issuing warnings about transitioning. So if you have someone that's on a computer, we don't want to just go up and say, hey, it's time to quit the computer, it's time to go take a shower. We can almost bet that that's going to sort of increase anxiety and lead to kind of escape or gaining access to the computer behavior. So we have things called time timers, or those red timers that you can see time pass, kitchen timers. Just a lot of ways that you can kind of prepare. In 2 minutes, we're going to be transitioning. We have 1 more minute, and then we're going to check our schedule. So just giving our guys that preparation. This is a huge one, really looking at prompting communication. So we really all talk about that behavior is communication. And so for a lot of our guys that don't have sort of traditional methods of communicating, we have to help them with that. Just an example of, we teach a lot at the Joshua School and a lot of places I've worked on kids asking for more time. So they may not have that skill, and so it's time to transition from iPad to work session instead of just kind of being kind of dogmatic about it and that we have to do it. Really, our guys may be engaging in challenging behavior because they want the iPad. They don't want to go to work time. So I'm going to give them a better way to say it. So we teach students to touch a picture that says more time, or for them to verbally say more time. And then if they're saying that instead of engaging in challenging behavior, we say, awesome, we'll set the timer for 5 more minutes. You can have more time. Sometimes we'll indicate how many times they're allowed to ask for more time. So we may have students that may ask for more time 1 million times. So I may just draw out 3 little tallies. You can ask for more time 3 times, and then we're going to transition. But really teaching that functional communication is super important.
Kate, I also think when that transition is really difficult, going from a highly preferred activity like electronics for a lot of our kids to something like work time. I know what's worked for me personally with my own kids and with a lot of families that we work with is having an interim step before that work or that non-preferred activity. So if the electronics are highly stimulating, so then providing a sensory activity as a second step, like playing with kinetic sand or playing with bubbles or doing something else that gives them some input before they move into the work can really be helpful.
Yeah, because that is a hard sell. And so that stepping down a little bit that kind of just calms everything down a little bit before you make that transition. That's a great point. Thank you. So again, with communication, you may have people you work with that use communication devices or pictures. Again, on the fly, even if you draw some things out, do you want to do this? Yes or no? See if we can make some touches or some choices. But just thinking about, why is this behavior happening? How can I prompt some communication around that? So let's say it's time to leave the park. And someone engages in challenging behavior because they really want to stay at the park, I may again prompt them to say no, or I'm not finished, or more time, or something like that. And again, this is not something that just happens like that, but teaching that communication and then reinforcing the heck out of that communication, it still gives them it still fulfills the function of that behavior, but just in a more pro-social way. And then we talked a little bit about teaching those coping and calming strategies. This is a huge component of what we do at the Joshua School. Acknowledging that things are going to be rough sometimes, and transitions are really hard, and changes in schedules are really hard. So instead of just, oh, we can't go outside today because it's raining, too bad, we can say, oh, it's raining outside, we can't go to the park. Here's some things you can do about it, but we can do these things instead. Here's some other alternatives to kind of help you cope with it. And again, presenting all that visually is really quite effective. And this is all stuff we could talk about for like 8 straight weeks. And so we're just doing a short little condense, but just wanted to give you some ideas. Reinforcement, so this is now talking about consequence strategy. So once a behavior happens, what do we do about it? And so reinforcing the positive behavior is so important. So we want to communicate to our individuals, when you did this, good things happen. When you do this, not so good things happen. So really reinforcing when you see the expected behaviors, if they're flexible with a schedule change, if they went up and initiated with a peer. And reinforcement is individual to the person. If they like M&Ms, we're giving them M&Ms. If they really like high fives and tickles, we're giving them high fives and tickles. I get money to go to work, and that's really powerful for me, and so I keep going to work. But really making sure, and Kristen will talk a little bit about this, but consulting with parents and looking at what is your guy or your kid really like, or what are some things that in the past have worked to kind of shape up more positive behavior. We talked a little bit about the attention piece, but varying the level of attention you provide for expected and unexpected behaviors. And so if you have a student that's engaging in challenging behaviors for attention, then we want to make sure that you're not providing that attention. So again, even the pieces of don't do that or stop or hands down, it is best to ignore that, and then at a later time prompt some communication around, you can say stop or no or come with me. And then redirection is always great, especially if you have people that are kind of perseverating on things or get stuck on things. Instead of addressing that head on, we can say, yeah, I hear that you're feeling that way. Here are a couple choices of what we can do instead. So kind of redirecting. And then the next piece is some specific questions, but I think as we kind of talk, we can just go through that. So Kristen's gonna talk about kind of the impact of challenging behaviors on family and lots of other things.
Thanks, Kate. Does anybody have any questions on what Kate just delivered before we move on? If you want to put them in the chat, we can address them as we're going. But for now, we'll just talk about the impact of challenging behaviors on family. So I want to just spend a little bit of time talking about how we communicate about challenging behavior with family members, because that can be really hard. This is really emotional content sometimes, and there are different places that families can be or caregivers can be, and you want to be thinking about crafting how you're going to talk about challenging behavior. And maybe understanding some of the pieces that go into impacting families. So we know from research that raising a child with developmental disability is really impactful on families regardless of the severity of symptoms. And I think that's an important thing to remember. We have such a broad population of children with all kinds of strengths and challenges. And so it can be really impactful to try to find help your child find their place in the world when they have their particular set of issues. And those stressors can come both from inside the family and outside the family. So a lot of times within a family structure or caregiver structure, there are people who have different ideas about how we should be handling things, what kinds of interventions we should be doing, whether or not the child truly has a particular symptom or characteristic or diagnosis can be a conflict. And then outside the family, there are a lot of stressors around setting up supports and services, especially in Colorado. We know we have very fractured systems of care, and it takes a lot of effort to navigate your way through those things, very stressful. So a lot of those challenges, including trying to participate in community events, that can be really hard for families. Those challenges really put family members at risk for their own increase in negative mental health outcomes. So lots of anxiety and depression and things like that when they're trying to deal with all of these components and pieces. So that's kind of the bad news. The good news is that there are protective factors for families. And so just identifying those risks and knowing that there are some protective factors can actually be very beneficial for families. And I think it's so interesting that social support in the research that I've done is shown to be one of the most influential predictors of good mental health outcomes. And social support, so peer-to-peer support, parent-to-parent support is hugely impactful, but also I wanted you all to know that your interactions with families can really make a powerful impact. The way you talk to families about their children and their challenging behaviors can really make a huge difference. So I want to talk a little bit about developmental disability and the grief cycle. Have any of you heard of this concept before? So lots of providers are trained on this concept, as well as parents. And this is a cycle or a model that was developed by Gil Foley, who's a clinical psychologist out of Albert Einstein School of Medicine. And so it's used pretty broadly. And some people really relate to the idea of it being a grief model, and some people don't really relate to that word. And so it can be helpful to think about it as just different phases of coping. And it's a framework that I think can really change the way you think about behavior and think about your interactions with families. It's somewhat artificial. Not everybody goes through these phases in the same order or all of them. And most frequently, family members are in different places in this cycle. So rarely do you have co-parents or grandparents and parents who are in the same place. And that can be really confusing for family members, but also for providers that are working with families. So this first phase is called disequilibrium, which is a mouthful. You can also think about it as kind of the loss of the dream phase. And in this phase, often happens right after families receive a diagnosis, or it can reoccur when families are experiencing milestones, or big transitions in life from elementary to middle school to high school, or into adulthood. And in this phase, lots of family members can feel a variety of big emotions. And I think the important thing to remember is that they're big. The feelings are very large, and they can really span a broad spectrum of feelings. It can be anger, sadness, hopelessness, as Brian mentioned earlier, guilt, shame over that child's disability and what we've done to bring that about or haven't done to bring that about. But I don't think it's really grieving who the child is, because I think the child is perfect who they are. I think as parents and caregivers, we're grieving the parent that we thought we were going to be and the experience that we thought we were going to have. And that can be a really big experience, right? So that's one phase of coping. The next is acknowledgement. And this is an interesting phase where families or caregivers can really bounce around in these levels of acceptance and understanding of what their child's challenges and disability are. And so they may understand that they have a disability and agree with the diagnosis, but don't think it's going to impact them over time, or that it's, they're going to get a job, or they're going to be okay in school, and we're not going to need to take care of them when they're an adult. And then slowly over time, you start to acknowledge and accept whatever level of support that child's going to need to be successful in life. And you would think that once you move to that level of acceptance, like you're there, but no, you're not. You bounce around, right? So that can be confusing for providers that are working with families. Well, I thought we were all on the same page with where these challenges were, but now the family seems to be questioning whether we need these strategies. The next phase is called recovery. And this is my personal favorite phase because I have children with autism as well. So I tend to hang out here a little longer than I should. But this is a really active phase of grief or coping. And I like to refer to it as a parent who's like the command center of Black Ops operation. And God help you if you get in their way, they're going to, right? Amen. They are going to get every support and service known to man, and you just better not be in my way. So it feels really good. You feel like you're making progress. No matter what's happening with your child, you feel like you're moving things forward. So it's very active. A family member or caregiver can be challenging to communicate with because they might be in that fight mode where they've had to be to get those supports and services. But they can also be a wonderful ally. If you're able to communicate with them about challenges, they're going to really work hard to bring resources to you. So it kind of is a double-edged sword. And like I said, some of us tend to hang out here a little bit longer than we have to because it feels good. And then maintenance is that final beautiful phase where families are feeling a real equilibrium, right? They have their supports and services in place, their child may be making progress, they are accepting this new parenting style that they've had to take on. Maybe they're building community, they're doing walks, they're doing some advocacy, and it just feels like, okay, I've arrived, I've been through all these difficult phases, and now I'm out. Now I'm moving forward. But unfortunately, as many of us know, we don't get to stay there very long. And so we tend to, the next time a trigger comes up, and we'll talk a little bit about those different triggers, we may go back to our favorite go-to spot, right? Maybe we'll go right to that sense of loss, but then, ooh, that doesn't feel good, so I'm going right to recovery and I'm going to kick some butt.
Hey, Kristen.
Yeah.
When you know your child's behavior is going to escalate, how do you emotionally prepare yourself for it in the few seconds that you have before your child's outburst happens?
Ooh, that's a good one. I don't know that I have a good answer for that. I think probably some of the discussions that Brian and Kate and I were having were thinking about behavior as a form of communication. So I see that my kid's getting dysregulated, they're amping up, they're going to struggle in this situation. Like, let's say I'm just going to throw this out there because my kids are going to high school registration tonight, and I have triplets, and so they're all registering at the same time. And I know that one of my sons has a lot of sensory issues, and being in a big space that's all new where he's supposed to be making some decisions, I'm anticipating that's going to be really hard. And so I'm going to be really kind to myself and be really kind to him and try and anticipate some of the things that he might need to support him through that. Is the only thing I can think of. Do you guys have any other thoughts?
I think I'm going to speak to it a little bit in just a minute.
Yeah.
Also just about, because it does have a lot to do with resilience. It has to do with your resilience, and it has a lot to do with your mindset. I think that it's something that you develop as a caregiver, and you maintain, and you access it in those moments. And I would love it if there was a real simple, quick answer to that. It's a very complicated answer to that question. Yeah. But I think that we're gonna talk about it in a bit, and maybe we'll have more of a pointed or a better understanding after we talk more generally how you develop that resilience.
And I don't know that I can think of an answer within seconds of a behavior, but I know that my husband and I use a lot of humor to cope with knowing that a difficult situation is coming up, and we might have some shorthand for our gallows humor and how we're going to handle that situation. And I know that a lot of families use humor to cope with those kinds of situations. So anyway, we move through these as we discussed, and I think there are some triggers in the home setting as you're working with families, or if you are a family member. Talking about challenges in itself can be very triggering. It's hard to focus on the things that our kids are struggling with. And if we are with a respite provider or with a family member, and the child engages in behavior during that meeting, it can be hard for the parent to watch your reaction to their child's behavior. Using strategies, interestingly. So even the act of using a visual schedule can trigger grief, because now I'm using something that's helping me see evidence of my child's disability. So when you're talking with families about using strategies, that might trigger some emotion for them. Community outings is a huge one. With a lot of the families that you work with that are requesting respite or using respite, community outings have either been something that they have given up on a long time ago, or they just have a lot of negative reinforcement around those experiences. You know, I've been to the playground and my son bit somebody, and then the mom yelled at me and it was horrible, and I said the F word, and now I'm never going back to the playground, right? So even discussing those community outings, or having faith that as a respite provider, are you going to be able to handle it? Because now I'm anxious about how it's going to go for you. Those are the kinds of triggers that we're talking about. And then upcoming school meetings or IEPs. I know families that block off the week before and the week after they have an IEP meeting for self-care, which Brian's going to talk a little bit about, and that looks different for everybody. But I know parents who feel like that is just so emotionally draining to focus on all my child's deficits and maybe have to argue with a huge group of school personnel, or have a difference of opinion, or try and really advocate for my child, has a variety of impacts on people, those kinds of events. So just quickly, in thinking about why it's so important, I think you have that framework of all of those phases of grief or coping that people are moving through, is it really impacts the way they're communicating with you. So in that disequilibrium phase, you might want to talk to them about a challenging behavior, and they're going to have a big emotional reaction to it because they're in a place that they're feeling those emotions deeply. They may not be able to help you implement strategies because it's not a very active phase of grief. Families talk about feeling paralyzed when they're in this place, when they're having a lot of emotion. They can't really think through strategies. The acknowledgement phase, I think the caregiver can really be questioning the diagnosis or the need for services. Maybe they don't think they really need a strategy, where you as a respite provider are seeing some things in a more objective way or in a different way, and the family is kind of bouncing around and understanding how they feel about using strategies. The recovery phase, like we've talked about, can be very active. They can have a very defensive response, or they can really be energized to help get resources for you to be able to go on a community outing and then implement a strategy that you're interested in using. And that maintenance phase, of course, that's our dream family when we're talking, our caregiver, when we're talking about things, difficult behaviors that you're witnessing or experiencing with their child. And they're very open to having those discussions, and they're in a place where they can do a lot of cognitive thinking through things and developing strategies with you. So when we are having those discussions around difficult behavior, I think something that the Joshua School is one of our basic philosophies is dignity is the birthright of every human being. And so dignity is just huge for us when we're talking about an individual. And so how we talk about their behavior really matters. We want to stay away from judgmental language when we can. Brian mentioned a little earlier, we in the field talk about aggression and aggressive behavior all the time. It's just pervasive. It's something that we do. But it really does place a value judgment on that behavior. It feels like there's a judgment around the intent of the behavior that may or may not be there. And so using language like, you know, I experienced, when Brian and I went to the park and we had to make a decision, he engaged in some biting and some hitting. I'm really interested. I love hanging out with him, and I'm really interested in figuring out how to help him with that transition. So looking at bringing in a lot of positives, I like to call it the positive sandwich. So you want to say something about their kiddo that you love, that you really like. Like Brian's really funny. He's a really fun guy. I love hanging out with him. When he bites and hits, I'm trying to figure out something. But man, is he funny. He has such great sense of humor. So kind of sandwiching that, that difficult behavior within some positives. Brian really hasn't ever bit me, but you never know. So just to finish up, questions to ask a caregiver, and I'm sure that you all do this anyway in your work as respite providers, and Kate mentioned parents really are, or caregivers, family members really are experts on their children. They've spent years a lot of times dealing with these behaviors. They also have a variety of providers in their life and may be working on strategies with their home provider, in their school setting, with their psychologist. And so really tapping into what have they developed over years that is working and what doesn't really work. So ideas on reinforcers and motivators can be really helpful. And also triggers for behavior, knowing like, hey, my kid struggles with transitions, so you really are going to need a sensory activity before you ask him to move on to something else if he's coming off of video games. Or is it going to be a really loud place? Is it going to, for one of my sons, we call it like the tipping point. He can handle an environment, a play, unstructured play environment, if there's 5 or less kids. If there's more than 5 kids, we're looking at some challenges. He's going to really, his communication skills are going to break down because it's too much input. So things like that, understanding what those triggers for behavior can be. So those are my thoughts on communicating with families, and Brian is going to come up and talk a little bit about building resilience as caregivers. But if you have any thoughts or comments on that family communication piece, please let us know.
I'm going to talk a little bit about resilience, something that I think is critical, whether you're a parent or whether you have chosen to go into respite care as a field. This is a marathon. It's not a sprint. And I'm not going to talk about self-care today. And the reason I'm not going to talk about self-care today is because as soon as I use that term self-care, I can feel this wave of guilt coming over our audience saying, oh my God, he's going to talk about all the stuff that I really know I should be doing that I really don't have time to do. And I don't like to listen to people talk to me about these things that I don't have time to do, that I should be doing to take care of myself because I'm a caregiver, which that's totally antithetical to what I'm going to be talking about, which is these levels of resilience. Our resilience as a human being in caregiving, okay? Because there's this interesting thing about caregiving. I mean, first I'm going to say about caregiving is that it's a noble thing to do. It's a very noble thing to do, whether it's a profession or whether it's what you are doing in your personal life. It is extremely noble. And the other thing is that we as humans have varying levels of things that constitute our resiliency, okay? And I have this slide up about rational detachment, which is a term coined by the Crisis Prevention Institute, that is, their definition is the ability of a staff person to maintain control of their own behavior in the presence of acting out. Okay, but I define it differently for myself. What I think is, this is a process that we go through every single day as caregivers, where this is a rational process that we're engaged in right now. We're considering, the types of disabilities that youth may have. We rationalize and consider diagnoses. We think about antecedents. We think about behaviors and consequences. We're engaged in this rational process right now of understanding this thing called dysregulation. Okay, so that in the moment we can detach ourselves emotionally, which is a very unnatural thing to do, right? But it's necessary, and the reason is because we have to regulate our own emotional responses so that we can respond effectively, so that we can keep our frontal lobe continuing in the midst of a crisis or in the midst of some acting out behavior. Because when youth that we're working with become dysregulated, we become dysregulated, and so this is a process that we go through over and over and over and over again. And the mindset, in order to answer the question we got earlier, I think that it's hard to answer that question because this is not a destination, it's a journey, right? And so what we're doing is we're going to rationally consider all of these circumstances so that we can detach ourselves emotionally, so that we can maintain control of the situation, control of ourselves, and we can respond effectively. And we can do it over and over and over and over and over. Okay, and I want to point out that this is just my own original thought. I'll be honest with you, this is not a lot of research behind this. This is just of 26 years of being in human services and working with challenging behaviors. This is what I've come up with for myself. And I want to point out that this model is not a matter, this pyramid is not levels of importance. I want to point that out. If people look at this and say, Brian, my spirituality is my basis, it's not but I just look at my physical well-being as being what's grounded to the earth. I walk around in this body, and it's grounded to the earth, and my psychological well-being is more of the mind and elevated a bit, and my spirituality is where the pain and suffering that I encounter in life as well as in my profession, I have to find a place in my universe for that, so it doesn't reside, because it's about wellness and it's about staying resilient, not only in those moments of crisis, but it's also doing it over and over and over and staying resilient, happy, and healthy as you caregive. And physical resilience, I'm just going to say really quickly, and go over these really fast, but getting your own medical treatment when you need it is really important. I mean, the old adage about, if we're in this plane and we lose cabin pressure and the mask falls down, you have to put yours on first before assisting with somebody. That's really very true. Now, the truth is that caregivers, we're very good at caregiving because we put other people's needs ahead of our own. Okay, but the thing is that if you think about rational detachment, you're regulating your own body in a situation that's really stressful, right? That's a mind-body experience. Okay, and so in physical resilience, getting your own medical treatment, having a reasonably healthy diet, getting good sleep, limiting your toxins to a reasonable amount, and I don't use the E word. I don't use the E word because when I use the E word, exercise, you're going to conjure this painful, aversive, sweaty thing that you really don't want to engage in. What I want to talk about is just routine, purposeful movement of your body. And what I mean by that is it can be a walk. It can be, it's a deliberate thing that you build in routinely. And the routine is where you want to start, not with, oh my gosh, I haven't been to the gym in 6 months, so I'm going to hit it really hard today. Because if you do that, you're going to be unsuccessful. Some days I don't have what it takes. I get my jammies on, and in front of the TV for 15 minutes, I'll stretch. And I find out that it's not aversive, it's not painful, it's really enjoyable. And I build it into my routine, because that mind-body work is exactly what you're building when you're trying to rationally detach during the day. If you can do purging exercise on a routine basis, then you'll be a Zen master when it comes to managing challenging behavior. There's cortisol, there's certain stress hormones that you build up. There's a fabulous book out there called The Body Keeps Score, which talks about how when you encounter stressful situations repeatedly, you store these cortisol and other kinds of stress hormones that are toxins, and you have to learn how to purge those things. I want to talk real quickly also about psychological resilience, which is utilizing healthy relationships in your life. And when I mean utilizing them, this is your friends, your family, your clergy. And when you like, there's this concept I want to talk about briefly called compassion satisfaction. Like there's huge satisfaction that we get from taking care of others. And it's what counters all the stress that comes with caregiving. So embellish it, relish it, savor it, understand that, and do not deny other people in your life their compassion satisfaction for taking care of you. Okay. Getting your own psychological help when you need it. And I want to talk about, we changed our slide. It's not just time off. I want to talk about purposeful time off. Purposeful time off. That is an active process of considering what you're doing when you're not caregiving that rounds out your life and fulfills your life, right? So that when you come back to it, you feel like you've utilized that time to the best of your ability. Don't get me wrong, I like a good staycation. I had a pajama day this past weekend, and it's exactly but it was prescriptive. It was exactly what I needed, right? Mindfulness and meditation and creativity, expressive arts. My new thing now is adult coloring books. You know what I mean? I mean, these are things that I have learned, and I'm going to talk about developing a resilience plan. This is an active process that most caregivers do not do very well or don't consider. But if you take a little bit of time and you include your loved ones in that resilience plan, it'll help you in the moments that you need it, and it'll also make this marathon more bearable. Professional development, and also getting and doing what you're doing today, and is getting education and getting support. Those constitute elements of psychological resilience. And then when I consider spiritual resilience, there's no doubt that people's faith and their religions can be extremely powerful when it comes to managing stress and letting go of things that are somewhat out of our control. But I also want to point out, and I'm going to let you read these slides on your own, but I also want to point out that there's other belonging to a spiritual community is really, really important. And in some cases that is an organized religion, but in some cases too, for example, my mother passed away from ALS a couple of years ago, and so I do the Walk to Defeat ALS every year, and I'm a part of a community once a year of these people who have experienced a unique human experience that I share. That's an example of a spiritual community that you can belong to. And when you think of it that way, you realize that you are parts of spiritual communities. You may not have thought of it that way. Embracing compassion and understanding that concept of compassion satisfaction, celebrating your own personal strengths. You're human, not superhuman. When I take off after work some days and I think, oh my gosh, that was absolutely exhausting. If I were a construction worker at the end of an exhausting day, my exhaustion, I stand back and I look back and I go, look at that thing that I did today, that I created today. Not just, oh my God, my hands hurt and I'm so sore. You have accomplishment in that exhaustion, and sometimes this is where you're talking about the humor earlier. Sometimes my colleagues and my families that I work with, we say, well, we kicked that boulder another millimeter today, and that's significant. That's very significant, and embrace it. And embrace the nobility of what you do in terms of your caregiving. So I'm going to just say that I really challenge you to develop a resilience plan, okay? And go and take a look at what are the prevention activities that you engage in. And prevention activities are a couple of different things. It can be that physical resilience, where you're going to build yourself up in terms of your physical health, but it's also other things too, like getting the psychological help, doing your own grief work, doing those things that are important for you psychologically and spiritually that are going to develop and strengthen you. Consider what are the soothing activities that you do. When I did my plan, I told you earlier, I'm a sensory seeker, so I have lots of discharge activities. When I started to put it together and I started to list what are these things that I do that contribute to my resilience, I realized I had a list of discharge activities that was really long, and that soothing activities area was really small. And so I challenged myself to consider what are those things that I could do. And hence the adult coloring books. I realized that's one of the things. I had a bathtub in my house that I hadn't been in 4 years. Rediscovered that. That's a soothing activity. That's one of the things that I need and so I started to fill in the gaps and places in my resilience plan that I had holes. Getting professional and social support and understanding that supervision or learning or just talking and consulting with people who you respect and admire and think know something that you could learn from. And then these inspiration and recharging activities. This is time with your children. This is time with friends and family. These are vacations that you plan and you take and you execute. Okay, and so these are all the different pieces. And I challenge you to and it's not difficult. Just take a piece of paper, write these areas down, and then just start to fill it out for yourself. And then do it with your loved ones, because they will be able to fill in gaps that you hadn't thought about. They'll give you, suggestions you hadn't thought about, and then put it down, and then pick it back up in a couple of months. And this, like I said, this is a journey. It's not a destination. You will never have your plan. Your plan will develop over the years, and it will significantly strengthen your resilience in those moments when you need it, where you need to access it. We're in extremely stressful situations, and it will also help maintain your health and happiness in the long run in caregiving. I think we're at the end of the slides then, and we're going to move into question and answer session. Okay.
Although we're at 11:30. So.
All right, we're at the end.
Any last questions? Do you guys have any questions?
Any questions?
Do you want to do a
Yeah, thank you. Appreciate it.
All right, thank you so much for people that are here in attendance and everybody who is here via the webinar also. As I mentioned, this webinar has been recorded and it will be available both on the JFK Partners website and on the Colorado Respite Coalition website. Along with that recording will be a training discussion guide if you'd like to use this in your workplace setting, and also an educational handout that will have everything that you saw on these slides, but also some extra and background information along with it. So thank you very much, everybody, and enjoy the rest of your days.